This week on Top 3 Tuesday, we're going to be talking about what we do for shoulder pain. Hey everybody, it's Dr. Andy and Dr. Brandon with Twin Cities Movement. We are here again on Top 3 Tuesday. We're going to be talking about shoulder pain. So this is more of an example of what we do in the office for someone who comes in with shoulder pain. If you remember last week, we talked about resetting, reinforcing, and reloading. So we would start a shoulder treatment by after assessing, of course, we would start by loosening up the tissue, just using some soft tissue work to get some more mobilization, more mobility in the shoulder so someone can attain the appropriate ranges of motion that we want them to have. So we're going to start this example with a quick shoulder mobility exam. So I'm going to have Dr. Brandon go behind his back, just like that. So this is more or less fine. We would straighten out the wrist a little bit, but it still touches where we want to there. And I'm going to have you do the same thing with the other side. Okay, and that's again very good. And then we're going to go up overhead. And again, that's fine. And then the other side. Was there any pain or discomfort with any of those? Okay, so normally we would consider pain, and if there was pain, we would treat that first. And then, again, this was a fine assessment. Dr. Brandon is not deficient in any shoulder movement, but we are going to pretend that he is. So the first thing that we would do if someone did have a problem with shoulder movement in here, let's say they couldn't get past here. They have a problem getting jackets on because they can't quite get overhead. That's the kind of shoulder tightness that people would come into this office for, and that's what we would do for that. So I'm going to have Dr. Brandon start on his back. And this is a pretty simple flexion and extension move. He's going to start in the middle, and one arm's going to go down, one arm's going to go up. Make sure core is established. Make sure that nothing else is doing a lot of work while he's doing this. Neck is relaxed. His upper traps are relaxed. They're not really doing any work. Let's check that here. That's good. Keeping shoulders away from ears, so shoulders can do what shoulders do, and the neck can do what the neck does. Good, and so you do a few of those per side. Make sure that he can demonstrate that with pretty good proficiency, and then I'm going to have you get up into the half kneeling position. And I'm going to stand up. And this is going to be a half kneeling chop. So you're going to start up at the top, move into the center, and then push down. Now you'll notice Dr. Brandon's hip and shoulders are pointed forward. So he's not twisting at the torso. He's just moving his arms across his body. So this is a nice core stability exercise as well. It's a nice challenge to balance because you're in a half kneeling position and you have all of this resistance on you and everything like that. It's something that it challenges a lot more than shoulder flexion and extension. So it's a good exercise for that. Last thing that we're going to do here is an assisted shoulder circles. So this is not really in any particular order. This is just the way that we would do it in this particular situation. I'm going to have Dr. Brandon do this shoulder mobility. So this movement that Dr. Brandon is doing is the shoulder mobility in the functional movement screen. So this is basically something that tells us that it would be less likely for him to have a shoulder injury when he is using his shoulders heavily for exercise. So this is a pretty good clearing to be able to do this. And we are going to basically help him do this by holding his shoulders back with the band here. So again, that was kind of 3 examples of things that we would do in the office for someone who has tightness or pain in their shoulders. You can share it on Facebook if you know somebody who has shoulder pain or has problem getting on a jacket or something along those lines. You can follow us on Instagram or Twitter, subscribe to our YouTube channel, or sign up for our email newsletter. Email newsletter. So that you can get videos like this delivered to you every week. Thank you very much for watching.